Hello, everybody. It's just a little topic to show you what you can find by ultrasound in an acute colitis in a young woman, and I'd like to compare the image between ultrasound and CT scan to see what is the most efficient technique. It's a 20 years old woman with no medical past history, no drugs, and she got a fever of 38.5 since 3 days with 10 stools a day and a very high right abdominal pain, which you can discover by ultrasound. Well, what you see the rectum, you see the uterine cervix, and when you turn the bladder and when you turn the probe to the left side, you see the uterus and you see the sigmoid, which is very thin with cases inside, and it's a very thin layer. And what you can see, you have to detect the rectum, you have to detect the cervix of uterus, the bladder, and you see the sigmoid, very thin, normal. And when you turn to the left side to see the left colon, you see that the layers are more larger. You see a dark one, which is the muscularis propria, the gray, which is the submucosa, and inside the dark one is the mucosa. But when you do the measure, you see that it's more than 3 millimeters. Then you can see that it's a left colitis. You see all the mucosa in the left side, all the layers, excuse me, in the left slide, and in the right side, you see that just in front of the kidney, you see very well the left colon. Then you have to pass in high frequency probe, and then you see that there is a little ascites in the left side, and what you see is a very thin sigmoid. You can ensure that the sigmoid is normal, and when you do the rotation, you will see the left wall, the left colon wall, which is larger. You see the three layers, the muscularis propria, the submucosa, the mucosa, and you can do an effective measure, which is 4 millimeters. It's too large, then it's abnormal, and in the Doppler you can see signals in the submucosa telling you that it's an inflammatory disease of the left colon. You see it well, there is some parasite, but you can see that in the submucosa you have red spot telling you that it's an inflammatory disease. Then that is the left colon. The transverse was normal, and we go to the right side, and to the right side we saw something very difficult in the low frequency probe because it's quite undifferentiated. It's difficult to see the layers, the bowel wall. We saw the posterior one, but not the anterior one, because there is a lot of liquid stools, and it's difficult to differentiate the pathology. But what you can see is when you see the bowel wall is very large, 7 millimeters. It's very abnormal. And then you do it with a high frequency probe, and then you can see very well that there is a lot of adenopathy, bigger one with a very hypoechoic, which that means it's very inflammatory. You see that the tissue is very white and very inflammatory too, and then there is a large artery which is useful, is normally a little artery which is called the ileocolonic artery, and it's larger because it's very inflammatory. There is a big inflammation. And when you see the right bowel, you have the wall, very large wall of the right colon, and you can see a very large submucosa, which is gray. And when you do a Doppler in it, you can see very well that it's a high inflammatory disease. What you can see here is red spot in all the submucosa, telling you that the right colon is very damaged with a lot of inflammation, and as you see, with a lot of adenopathy. And when you go to the right, to the left side, you can see ileon, which is completely normal, with a thin bowel wall and no Doppler sign, telling you that the pathology is only colonic. Then you see very inflammatory cecum and a lot of adenopathy. And we now compare with the result of the CT scan, and you can see in the CT scan the left colitis, which is not so important, but in the right side, and the liver, you can see a very larger wall of the right colon, and as in echography, you can see a very difficult image, which is undifferentiated between stools and bowel wall. It's obviously pathologic, but it's difficult to see, and the adenopathy is less visible than what it was in echography. The echography was better to see the lymphoadenoitis, and when you go downstairs, you can see that the sigmoid is thin. The sigmoid is normal. There is liquid stools, but it's normal. Then the conclusion is that you have in the ultrasound the left and right colitis with normal sigmoid and transverse colon. You see that the measured images in the cecum, there is a very high inflammation with inflammatory lymphoadenitis and ascites. It's a typical findings of an acute infectious disease. The more specific one is Campylobacter infection, which is usually more aggressive to the right colon, but it can be Crohn flare, and you have to make the distinguish. In fact, you will confirm by bacteriology that Campylobacter is inside, but sometimes you won't have it. But what is very interesting is the follow-up, where you can see a very rapid decrease of the lesion in ultrasound, and the bowels become normal in less than